People say America has a free market healthcare system. It's just so false that kind of just makes me sick to my stomach a little bit. Man, like just look up CON, Certificate of Need laws. Basically, if you want to start a hospital to compete with local hospitals, you need a certificate from the government. Well, guess who's on that board to be able to give you that? Other hospitals in the area. So basically, if you want to open up a new McDonald's, Burger King and Subway and other fast food restaurants are on that panel telling you, yeah, dog, we're cool. We have enough fast food in the area. That's how they justify those laws. Those laws are supposed to be meant to prevent oversupply of healthcare in the area. What does that what does that actually translate to? From prices going down. That's what it is. On top of that, you have an artificial cap on the amount of doctors that can graduate. And on top of that, you have a cap of what nurses can do. So there's an artificial demand for doctors' time. A registered nurse can do so much more and save so much doctors' time, but they can't. It's just artificially capped in law. Then these healthcare companies, they're just public utilities, really. They're public. You can look at their books. They are capped at, for every single procedure, operation, everything, they're technically capped at 15% profit, but they actually hardly ever make that. It's more like around like 3 to 6%. So just think about that. Let's say you make U.S. healthcare 3% cheaper. Is that really going to solve it if you just take away all the healthcare insurance profits? Not really. As a matter of fact, if you take all the profits that these healthcare companies make, that's smaller than the government. That's smaller than the fraud in Medicare and Medicaid annually, which is mind blowing. When idiots like Luigi Mangione or whatever want to kill a healthcare CEO, it's like, what are you smoking, man? You're mentally, like, you're retarded. Healthcare is the most regulated industry in America with hundreds of thousands of like paid laws and regulations. It's basically centrally planned. What about you're going to take it out on the CEO with a company that makes like a 3%, like a glorified bill collector makes like 3% markup on all this stuff, when there's thousands and thousands of politicians that wrote all these laws and enshrined all these healthcare monopolies into law. So if you're advocating for a single payer healthcare system, that's fine, but just know the only way to really save money is to pay doctors and nurses a lot less, like they do in Europe, because our government system, a government enshrined monopoly, just basically pays them more, and that's why it's so much more expensive here.